Get started, and we encourage people to continue to introduce themselves in the chat box. So before we get going, I wanted to offer a land acknowledgement. While we meet today on a virtual platform with people joining us from across the province, I'd like to take a moment to acknowledge the land that I call home. I'm speaking to you from the traditional territories of the many nations, including the Huron-Wendat, the Anishinaabe, the Chippewa, the Haudenosaunee, and most recently the Mississaugas of the Credit River First Nations. And the area is covered by Treaty 13 with the Mississaugas. Today, this gathering place is home to many First Nations, Inuit, and Métis people. And as OCO team members, we are learning about the lands from which we work and exploring how we can be meaningful allies and how we can support the recommendations from the Truth and Reconciliation Commission. And we do this to reaffirm our commitment and responsibility in improving relationships between nations and to improving our understanding of local Indigenous peoples and their culture. And I'm grateful for the opportunity to live, work, and learn on this land. In particular, as we approach the National Day of Truth and Reconciliation, I am reflecting on my role as a settler and how I will continue to learn and recognize the ways in which colonization and the history of residential schools has impacted Indigenous peoples. And I will continue to build my knowledge and learning well beyond September 30th. Recently, we had some discussions at OCO and talked about the Witness Blanket, which is an art installation that tells the stories of residential school survivors. And it was such an impactful and engaging art installation. And I encourage you to take a look, and we'll share the link in the chat shortly. And I'll also share a link to Whose Land, which is a way that you can determine which land you're on and build your understanding and knowledge about that. Thank you. Next slide, please. So we are so thrilled to have you all join us here today from across the province. And our goal really is to have you leave with an understanding of why caregiver involvement is so critical to improving transitions and how and why it's important to your OHT. We'll also hear from the Registered Nurses Association of Ontario and Northwestern Toronto OHT, who will share examples about how they've integrated caregivers across their OHT work. We'll hear practical tips from the RNAO, and we'll share some resources and tools with you that you can use within your OHT. I am so pleased to be joined today by Adam Wadden, Tiffany Boudou from the Northwestern Toronto OHT. I'm looking forward to their presentation. And we also have Kristen Campbell and Lindsay Howitt from Registered Nurses Association of Ontario. And my name is Bianca Feidelberg, and I'm with the Ontario Caregiver Organization. Next slide, please. So for those of you who are not aware of the Ontario Caregiver Organization, or the OCO as we like to call ourselves, we are a not-for-profit charity funded by the Ministry of Health, and we exist to improve the lives of Ontario's 4 million caregivers. And those are folks, supporting family members, partners, friends, or neighbors. And really, it's no matter what their age or the diagnosis of the person they're caring for or where they are in Ontario. Our work is centered on caregivers, and we offer a variety of free programs and services, both in English and French, to caregivers across Ontario, including a 24/7 helpline for caregivers to direct them to their supports and services that they need, both for themselves and their care recipient. And our work also includes gathering insights from caregivers and engaging caregivers in program development and design. Next slide, please. In addition to what we offer to caregivers, myself and some of my colleagues here at OCO are really focused on helping healthcare organizations, including OHTs, to implement caregiver inclusive practices to improve patient and caregiver outcomes. And we approach this work with these 3 key pillars. Now, if you've attended any of our webinars before, you have likely seen these, but just a reminder that our pillars or our focus areas are the identification of the caregiver or recognition of caregivers at point of care, the inclusion of caregivers as partners in the care team, and really the important support for the caregiver, connecting caregivers to support for their own needs. And at the foundation of all this work is we're working with organizations to help them think about how they're engaging caregivers in planning and design. And you'll see there at the bottom of the screen, we've listed a range of ways that we do this. So, the first is through learning events such as this one, which are large, broad-scale learning events, but we also offer tailored education sessions for providers. We have a number of tools and resources designed specifically for Ontario health teams to support you in your work. We collaborate with OHTs and organizations offering guidance and support. We're happy to be a part of working groups or conversations to support this work. And then lastly, but of course, just as important, is we have all these programs and services that we can help you connect caregivers to support for their own well-being. Next slide, please. Thanks. So before we get going into the bulk of the presentation, I wanted to spend some time setting the context about caregiving in Ontario. So this is some information from our Spotlight report from 2023, which really highlights, who are these 4 million caregivers across Ontario. So we know that 51% are what we would consider sandwich generation folks, meaning that they are folks like myself who are looking at caring for their own parents or in-laws, but also raising young children under the age of 18. We know that 49% of care recipients live with a caregiver. So as you're thinking about your plans for home care in the community, this is of importance and of consideration. And lastly, we also know that OHTs, for many of you, are working on or focused on frail older adults, and almost half of the care recipients are 75 years or older. Next slide, please. Here I've highlighted a little bit of the caregiving experience. So again, some information from our Spotlight report, but really helping us to recognize how stressful it can be for caregivers, that they're often navigating services for the care recipient. Many caregivers in the most recent report indicated that the responsibilities that they're taking on become more and more complex over the years, and they're taking on more as time progresses. And that in the quote on the right there, which is from an earlier Spotlight report, we're seeing very much how how stressful it is for caregivers to manage in transitions, and really how their caregiving responsibilities, the coordinating of care, working with multiple providers can be quite challenging. Next slide, please. So I have included this quote here, which, a while back at OCO, we heard from Bryna, a caregiver who's now the co-chair of the Essential Care Partners Support Hub Advisory Committee. And she made this statement about transitions are terrifying. And it really stuck with me because we know that transitions can often hold the unknown. Folks don't know what their responsibilities are. The tasks may be new and stressful, both for the patient and caregiver. And certainly we know from providers like yourselves, from OHTs, that transitions are a real pain point, a goal for improvement across the OHT, and also a stress and pressure point for providers. So it's in all of our best interest, as we kind of settle into this presentation day, to think about the ways that we can improve transitions and really the critical role that caregivers have in that work. Next slide. So why are caregivers so critical to OHT work? Over the next few slides, before we get to our presenters, I'll just share a little bit about, how this links to your existing work. We know that you have a number of priority areas and deliverables, including readiness for integrated home care delivery, improved system navigation, decreased alternate level of care stays. And so I will share with you here now just a little bit of how caregivers are so critical to the work that you're involved in at your OHT. We often have shared in previous presentations, you may have seen it, this statistic of 75% of care is provided by family caregivers. And many of us at OCO and folks across the province attended a session in February at Partners in Care, bringing together healthcare leaders, caregivers, providers, and OHTs. And we were fortunate to hear from caregiver Terrence Ho. And in his speech, he shone a spotlight on the reality of weekly calendar schedule for the care of his brother, which you can see here, highlighting all the hours that the family held the primary care responsibility. This highlights very much how critical caregivers are, what the 75% looks like in real time. And so as you consider how you're coordinating plans for transitions from hospital to home, it becomes clear how essential caregivers are to those integrated home care delivery plans. Next slide. We also know, and we heard from our findings through our Essential Care Partner Support Hub evaluation, just how critical caregivers are as the thread. They are often the continuity. I love this quote because it reminds us that caregivers are a critical thread to the patient journey. So they often have information that can support sustained care plans. They have information about who the patient was before they were a patient, and can support improved pathways or transitions across care, and sustained transition plans as well. This was also from our Essential Care Partner Support Hub evaluation. Next slide, please. We also, in our work, this evaluation, we reflected and spoke with many providers, caregivers, and through key informant interviews, we were able to gather this information about just how critical caregivers are to the healthcare system. So, the inclusion of caregivers leads to better health outcomes, improved quality of care, improved care transitions. And this was underscored further in our research studies, which I'll point to in our literature review that was done, that I'll point to shortly. But to give you a snapshot here, just how it improves both the quality of care, it reduces caregiver stress, which we know has a huge impact on burnout for caregivers. Next slide, please. And certainly caregivers are critical to equitable care. They can often be the bridge, the gap in language barriers, and ensure that the patient receives culturally responsive care and value. When we value the knowledge that caregivers bring to the table because they have a deeper understanding of the needs of the patient, it can provide fundamental care and can flag potential harm. So just, again, this was from our partners in Care Roundtable, reflecting a little bit some of the perspectives out there across the province about this work. So this, highlights the literature. As your OHT is striving to decrease alternate level of care stays, we know that improved transitions and the inclusion of caregivers are critical. And when caregivers are actively engaged, when they're educated and prepared for transitions home, it can reduce readmissions and support sustained care in the home and community. They play a huge role in ensuring that there is the best care pathway for the patient and avoiding unnecessary hospitalizations. And certainly this doesn't happen without processes in place to ensure that providers are included early on. So at the beginning of care, throughout care, and at transition points. So before we move on to our fabulous presenters, I just wanted to, reflect on, we've highlighted here, for example, some of your priorities. We know these are your 3 clinical priorities that you're faced with at the OHT, but that you also have structural priorities as well. But as you're thinking about this, and based on the information that I've shared earlier, as you consider your integrated home care delivery plans and readiness for that, have caregivers or the consideration of caregivers being included in those models? How are, considering that caregivers are supporting and managing patient care in the home, as we saw from Terrence's calendar, are they going to be well supported in your care plans? And when we consider, thinking about chronic health conditions and management, caregivers are often managing medications, appointments, those types of things. And certainly we know that often caregivers are responsible for navigating services for patients. So leaving that with you as you will move on to our presenters. And at this time, I'm really so pleased, next slide, please, to introduce Registered Nurses Association of Ontario to get us started. Kristen and Lindsay are going to kick us off and talk a little bit about their work and the best spotlight practice or spotlight organizations. Over to you, Kristen and Lindsay. Thank you.
Okay, great. Can everyone hear me okay? I think so. So thank you, Bianca, for providing this important context to this work. And good afternoon, everyone. It's an absolute pleasure to be here today presenting alongside the Ontario Caregiver Organization and Northwest Toronto Ontario Health Team. So today I'll be providing a brief overview of the Best Practice Spotlight Organization Program for Ontario Health Teams, for short, BPSO OHT. the program. This is a valuable resource designed to support and strengthen the efforts of Ontario health teams. So as you hear from Northwest Toronto OHT today, this context will help frame the BPS OHT program and how it serves as a foundation for much of the work being discussed today, helping drive better outcomes across the system for persons and caregivers. Next slide, please. So what is our plan? So again, just providing a brief overview of the BPS OHT program and why does this program matter, how the BPS OHT program deliverables are designed to support the quintuple aim, program supports and resources. I'm going to turn it over to my colleague, Lindsay, who's here with me today. And Lindsay's going to provide an overview of the Transitions in Care and Services Best Practice Guideline, specifically recommendations focused on caregiver integration and some next steps. Next slide, please. So what is a BPSO, Best Practice Spotlight Organization for short? So this is a designation by initiated by RNAO in approximately 2003 as a strategy for sharing and applying knowledge towards improving health outcomes. This program is funded by the Government of Ontario. It is a globally recognized program with approximately over 1,500 organizations participating worldwide across health service and academic organizations. And the program supports effective implementation and sustained use of best practice guidelines and delivers improved outcomes for patients, providers, and organizations. The program's strategic methods foster an evidence-based culture and support organizations in achieving the quintuple aim for healthcare improvement and innovation. So next slide, please. Oh, sorry, if you could go back one. Thanks. So what is a BPS OHT? So again, I'm being careful with acronyms here, the Best Practice Spotlight Organization for Ontario Health Teams. So in 2019, in response to the transition to Ontario Health Teams, the BPS OHT program was established by the RNAO, building on the success of our Best Practice Spotlight Organization designation program, offering a tailored approach to expand and share best practices within integrated systems of care. So for example, implementation of the Transitions in Care and Services Guideline promotes consistent best practices with a goal to enhance safe, quality, person-centered, and seamless transitions. And you're going to be hearing an example of that today from Tiffany and Adam from Northwest Toronto Ontario Health Team. It is a formal partnership with RNAO for a 4-year pre-designation period where BPS OHTs are supported to systematically and collectively implement and spread best practices across sectors and disciplines to achieve designation. Tailored strategies to support OHT objectives and deliverables, ensuring alignment with the quintuple aim by enhancing patient outcomes, improving the patient experience and reducing costs, and supporting healthcare provider well-being and advancing health equity. And the program, we hear this all the time, that it provides structure and uses approaches to mobilize teams from across disciplines and sectors, including patients and caregivers, towards their collective goals and evaluating outcomes. Next slide, please. Thank you. So this map represents the OHTs we are currently working and partnering with across the province. On the left, we have our 4 founding BPS OHTs who received their official designation at RNAO's AGM this past year. And Northwest Toronto OHT proudly is one of the founding partners and was designated this past June. So congratulations to Northwest Toronto BPS OHT. It is important to note these BPS OHTs represent over 45 signatory and non-signatory partner organizations across sectors who are or will be implementing the Transitions in Care and Services Best Practice Guideline. This represents an opportunity to collaborate, share learnings, problem solve, and celebrate successes. Next slide, please. So we just want to share with you an overview of the program, again, just very briefly, and some of the supports that are available to Ontario Health teams. A dedicated coaching team that provides tailored support to meet the specific needs of the BPS OHT. Robust best practice guidelines. Today's focus is on the Transitions in Care and Services Guideline that advance OHT goals and align with priority populations. Leading Change Toolkit. This is an online implementation resource that provides up-to-date evidence, tools, and strategies to lead change across health sectors and settings. There is a strong focus on the uptake and sustainability of knowledge or evidence, and uses 2 complementary frameworks to help accelerate your success, including the Knowledge Action Framework and the Social Movement Action Framework. Capacity building. So we're really proud of our champions network and training of champions. These are your change agents, and they raise awareness about best practice guidelines, mobilize peers, and use change management processes. There are knowledge exchange meetings and other opportunities for capacity building. And just important point here that our champions also include patients and caregivers. They're crucial to this work. We also have quality indicators for reporting and evaluation. And I mentioned opportunities for knowledge exchange with the local and global network that I mentioned. And we do have a $15,000 funded fellowship opportunity. So I'll just now turn it over to Lindsay, who'll provide an overview of the Transitions in Care and Services Best Practice Guideline and recommendations focused on caregiver integration. Over to you, Lindsay.
Thank you, Kristen. It's a sincere pleasure to be with you today. My name is Lindsay Howitt, and I've had the pleasure of working on the development of this guideline that was released in 2023. So in 2023, RNAO released our 2nd edition of the Transitions in Care and Services Guideline because we recognize the crucial importance of this topic for all sectors and all people experiencing transitions. And as Kristen mentioned, these resources are freely available and you can download it online, and there's a QR code as well on this slide. This guideline was developed using a really rigorous process that follows international standards for guideline development, and it was developed in consultation with an expert panel that included people who had experiencing transitions as patients as well as caregivers. This was so important for us to ensure that we were hearing from those most impacted by transitions in care. And there was also representation on our panel from members of OHTs, including Northwestern Toronto OHT. Next slide, please. So what is the purpose of this guideline and the scope? The purpose of this guideline was really to provide evidence-based recommendations for interprofessional team members, organizations, and the health system to support safe and effective transitions in care for children and adults and their caregivers. The guideline focuses on transitions between and across settings, including settings such as home, hospital, rehabilitation, long-term care, and many other settings as well. And we also truly recognized that many populations experience barriers during transitions in care. So the guideline was developed with it specifically in mind to ensure that the recommendations would support integrated care and promote health equity as well. Next slide, please. While you're skimming through the guideline, you'll see that there are 5 good practice statements and 3 recommendations, which are both methods of providing guidance, and they fall into 5 broad categories. And today I just want to focus in on 3 of the recommendations or good practice statements specifically that are very relevant to the involvement of caregivers during transitions in care. And later on in today's presentation, we'll hear from Northwestern Toronto OHT, who will provide more detail about how they have been implementing this guideline and integrating caregivers into their work. So next slide, please. So the 3 that I want to focus on are the following. And the first one really focuses on the vital importance of collaborating with people and caregivers before, during, and after a transition. In our guideline, you'll find a write-up for each statement, as well as a variety of different resources afterwards to support organizations and health providers and people who are experiencing transitions themselves implement these recommendations. This overarching statement is foundational for implementing all other recommendations in the guideline. And we know that the benefits of collaborating with people and caregivers is so clear. When people receive the information they understand and can act upon, they're better equipped following a transition. And it also talks about the importance of shared decision making, which involves really integrating caregivers' wishes and preferences into decision making. The second one on this slide here focuses on assessing care needs and readiness for a transition, as this can really help identify the care and assistance that people and caregivers may require following a transition. Readiness involves assessing things like medical stability, ability to self-manage care, the goals of the person and caregivers, including what a good transition looks like for them and what outcomes are important for them. And one of the things that is really highlighted in this statement as well in the guideline is the importance of using a strength-based approach when conducting these assessments and recognizing the existing knowledge and capabilities and connections that the person and caregivers have already that can help achieve their goals during the transition. And finally, I just want to speak to the third statement, which is on the next slide. And this is really focused on the importance of providing people and caregivers with information and support to manage their needs during the transition. This includes things like individualized health education or coaching to promote self-management, help with scheduling appointments or providing connections for transportations, and helping people and caregivers identify complications that might arise or warning signs that would prompt them to receive and get more help. When people receive this information, we know it empowers them in their care and increases their confidence in navigating the health system. And at this point in time, I'm going to pass it back to Kristen, who's going to share just a little bit more before we pass it on to Northwestern Toronto to tell us more about their implementation of the guideline. Thank you.
Great, thanks, Lindsay. So I just wanted to leave you with a couple of key points. So just to recap, the BPS OHT program is aligned with the Quintuple Aim and OHT deliverables. It provides and offers structure and supports to help disciplines. So that's all disciplines. Although we are the Registered Nurses Association of Ontario, the guidelines are meant to be inclusive of all disciplines, not just nursing. Across the spectrum of care to work together to implement consistent evidence-based practices. The Transitions in Care and Services Best Practice Guideline is a foundational guideline for all health sectors and really seen essential to the work of BPSO OHTs. And lastly, the Transitions in Care and Services Best Practice Guideline provides evidence-based recommendations for nurses and members of the team, organizations, and the health system to support safe, effective transitions in care for pediatric and adult persons and their caregivers or their support network. Okay, thank you.
Thank you so much, Kristen and Lindsay, for providing that overview. I think it's really helpful to get a sense of the key practices and how they relate to the inclusion of caregivers, and really appreciate you taking the time. And there we have Kristen's information for folks that are interested in connecting. I saw that there was one OHT that says that they're a part of the BPSO, so really feel free to offer any comments on some of the work that you're doing there. And I'm now so pleased to pass this presentation over to Northwestern Toronto OHT for them to share a little bit of this work in action. And to kick us off, I'd like to introduce Adam, who is a caregiver and co-chair of the Patient Family Advisory Council of the Northwestern Toronto OHT and a member of the ALC working group. So over to you, Adam, to share a bit around your experience of the caregiving journey.
Hi, everyone. I'm here to put a human face on the issue of caregiving and transitions in care. I'm going to get very old tech here with this. Here's the face. Can you see that? That's my mom in 1963. She still looks the same, just a few pounds lighter. My mom, Janina, is 95 years old, an orphan, a survivor of World War II, transported from Poland to Siberia. She witnessed her father hurled by soldiers from a moving train into the woods of Siberia. She witnessed her mother die at a railway station. There were thousands of Polish orphans in Siberia living hand to mouth. No country would offer them sanctuary, living on forest berries, mushrooms, and onions from farmers' fields. She suffered from malnutrition, the consequences of which began to manifest themselves 85 years later. After Germany invaded Russia, she took the arduous journey by truck via the mountains of Turkmenistan, Afghanistan, and what was then Persia to India, where the Maharaj of Kolhapur personally adopted 640 Polish orphans to circumvent the British colonial government and set up an orphanage on his estate where Mom spent the rest of the war. All this before the age of 13. There's a lot more to her story than I have time for. You'll have to wait for her autobiography for that. She went through a lot, but she's still tough as nails, all 75 pounds of her. She's refused medication all her life, which could explain her long life. She even insisted on having root canals without freezing. 8 years ago, she fell and fractured her hip, then her shoulder. That began a long journey with multiple transitions from hospital to home to rehab to complex continuing care to long-term care. I found the beginning of my caregiver journey where she transitioned to care at home quite stressful. I would drive to her apartment daily to assist her. She is fiercely independent, and I have a health and safety background, which created ongoing differences of opinion. We found that personal support workers were putting in half the allotted time. She kept notes. This alienated them. CCAC, now OHA, provided minimal information on programs to assist her and nothing at all regarding caregiver supports. If you're aware that something exists, you may type it into a search engine and find all kinds of information. It has to be on your radar in order to search for it, though. I've heard from numerous other caregivers who were completely unaware that there were any resources available to them. It was not until much later when, in my capacity as a Northwestern Ontario Health Team Patient Family Advisory Council member and chair of the Alternate Level of Care Working Group, I met Bianca from the Ontario Caregivers Organization, and she made me aware of the abundance of resources which I could have accessed. Once my mom transitioned from her home and was permanently in the healthcare system, I developed my own 3-point strategy to ensure her well-being. Monitor, question and respond. Monitor the patient's mental and physical health. This involves regular visits and phone calls with the patient, conversations with nurses, care managers, reviewing medication charts. Question those responsible for her care, including further researching their answers, and respond. This is the toughest part for a lot of people. This can involve anything from quality of care to appropriateness of treatments or drugs and dosages to outright intervention, the latter which twice saved my mom's life. During the first wave of COVID, my mom's hospital was under quarantine. I was denied visiting access to my mom in complex continuing care. One night, she called to say she was in unbearable facial pain. This from someone who never complains about pain. Because she was unable to get to the washroom on her own, she had been unable to brush her teeth for 6 months, and the hospital had not done even a routine oral health check in that time. I took her in a blizzard in her wheelchair to a dentist down the street who was so horrified he insisted on taking photographs. She had such advanced gingivitis that her gums looked like hamburger. Trying to get the hospital staff to assist with my mom's oral care, even after this, proved to be a hopeless task. As chair of the Patient Family Advisory Council for the hospital, I tried to have them initiate an oral health policy that would involve routine oral health checks, but ran into ongoing resistance from administration. Mom still has ongoing pain to this day and visits the dentist every 3 months for remediation. Twice, Mom was declared palliative. The first time, when she was ALC in complex continuing care, she was given 2 days to live. I asked to see her medication chart, found she was on the 3rd 5-day course in a row of a powerful short-term corticosteroid, which should not be repeated in close proximity. I insisted that they stop the medication, and in 3 days, she was back to normal. This winter in long-term care, she caught COVID and became critically dehydrated, necessitating a transition to emergency. They called me to say that she would not last more than a few hours. When I got to the hospital, Mom was writhing and unresponsive. I asked why she had not been given intravenous hydration. The emergency room physician said she could not possibly recover. When I insisted, they called an internist who said all my mom's organs were severely compromised, and if they gave her fluids and she survived, she would be, in his words, a vegetable. I intervened and insisted that they give her an IV immediately. Within 10 minutes, she stopped writhing. Within 20, became responsive, and a couple of days later was back to her normal self. When she became alternate level of care, I toured in excess of a dozen long-term care homes. I immediately rejected all the for-profit facilities, which, in my opinion, should have a separate designation of LTN instead of LTC. I then narrowed the list down to 4, visited them again, and then looked up the inspection reports and complaints investigations. That deleted 2 of the most beautiful modern facilities based on issues with neglect and respect. It was worth the research. Mom still has a good quality of life at her long-term care home. She's well cared for, and I can see that the staff love her. When she transitioned from hospital to long-term care, she went from being bedridden 24/7 with severe pressure ulcers to being in bed only at night, participating fully in all activities and field trips, and something no one predicted, walking with a rollator. In order to allow caregivers to fulfill their obligation to ensure the best health for their loved ones, OHTs need to adhere to the Ontario Caregiver Organization's 3 pillars. Identify the caregiver, include the caregiver, and the one that's most commonly omitted because it involves the most work, support the caregiver. This will enable caregivers to be effective partners with the OHTs in the care of their loved ones. Thanks.
Oh, Adam, thank you for sharing that very powerful story about your mom. And I really appreciate how you brought her to life with the photo of her, and then really were able to make the link for us in a very real way about how fundamental your role was in advocating for her and all your knowledge about her as the patient. So thank you for taking the time to share that journey with us in a very real way, and we're grateful for that. I'm going to pass it over to Tiffany, who's now going to lead us through this last part of the presentation to share a little bit about how this work came to life at the Northwestern Toronto OHT. Over to you, Tiffany.
Thanks, Bianca, and thank you so much, Adam, for sharing your story. Every time I hear it, it always just brings tears to my eyes, because it just helps us to realize and ground the work that we're doing as OHTs, and remind us that we're doing this for our patients and for our clients and for the community members that we serve. Next slide, please, Ferdosa. Thank you. So I'm representing the Northwestern Toronto OHT. We are located in the North York West subregion of Toronto, which I've outlined on the map here. Our community has a greater prevalence of chronic conditions such as diabetes and hypertension. We also have a higher population of seniors aged 80 and older, many of whom live alone. Our community also has poor access to mental health services and has one of the highest needs for primary care in the province. So it just gives you a bit of a background of the complex needs of our community members. We currently have 14 signatory partners listed on your screen here, and they work across various sectors of acute care, community care, mental health and addictions, and rehab care as well. Next slide, please. So here's a screenshot or snapshot of the senior profile within our OHT 65 years age plus. So this is basically an overview of the seniors accessing Ontario Health at Home services within our catchment area. So you can see at least half of those accessing Ontario Health at Home services are at greater risk of long-term care home placement within a year. Within a year as well, many of these seniors also experience a caregiver burnout, or at risk of experiencing caregiver burnout within the year. So this just helps us to build a bit of context of who we're serving or who we're actually seeing within our OHT itself. Next slide, please. So some of the key enablers within our OHT that we would like to leverage in order to do this work. So when we first took on, what can we leverage within the OHT to help us do this work? There were 3 key enablers that we had identified. So our collaborative quality improvement plan, or CQIP plan, which, as we know, has an indicator regarding ALC levels and decreasing ALC levels. We also looked at our best practice follower organization. So as a PPSO OHT, was there any opportunity for us to leverage any of the best practice guidelines to help us complete this work? And then obviously looking at our patient family advisory committee. So is there any way that we can actually embed our caregivers within the work that we're doing? So really, we were looking at where can we create alignment between all 3 of these different assets to ensure that we can actually move this work forward. Next slide, please. So first looking at CQIP ALC, so as I mentioned, our collaborative quality improvement plan, and recognizing that we are mandated to look at decreasing ALC rates within our OHT catchment area. So like many of you, our ALC working group had cross-sectoral representation from acute care, community care, and long-term care. So this was a benefit and asset for us because we could look at spreading and scaling ALC awareness, not just within the hospital walls, but into community as well. So our target population for CQIP is caregivers of frail seniors. And some of the problem statements we identified through literature and through discussion with our local service providers really were around 3 main areas. So system navigation, so caregivers experience barriers with system navigation, access to information and communication, assessment of needs, so the need to improve caregivers' understanding of the services available for seniors and the most appropriate care setting to receive care. And lastly, inclusion in the care team. So service providers have a direct role in recognizing caregivers as part of the care team. Next slide, please. So looking at our second enabler, which was our best practice spotlight organization work, and specifically leveraging the transitions in care and services best practice guideline through the RNAO. So the goal of BPSO OHTs are really to look at collective implementation of best practices and policies across the OHT. So we felt this was a natural fit with the work that we were trying to do with embedding caregivers into our initiatives. So we had very similar or basically the same representatives within our ALC working group. They're also part of our PPSO working group. So it was a natural fit to leverage both groups to help complete this work. I won't go into detail around the best practice statements identified in the actual BPG because the team from the RNAO did that really well. But we leveraged 3 best practice statements in particular to help us complete or guide the work that we were doing. So first was around navigation support, which aligns to what we found from our actual service providers within our ALC working group as well. So around navigation support, this is specifically around providing persons with information and support to manage their needs during transitions in care. 2 is assessing care needs and readiness for transition. So looking at assessing persons and their support network, assessing their care needs and readiness for an actual transition, and then collaboration with persons and their support network. So this looks at collaborating with persons in the support network before, during, and after the transition in care in order to ensure a safe and effective transition. Next slide, please. Our last enabler was around leveraging our patient family advisory committee. And really the goal of our PFAC is to embed patient and family perspectives into OHT initiatives. So we took this as an opportunity to incorporate co-design principles into our caregiver initiatives. We were lucky because we had 2 PFAC members who had direct caregiving experience that were interested in supporting this work as well. And Adam, being one of 2 caregivers, helped directly to provide input on our various caregiver initiatives. Next slide, please. So how did we start this work? So we first looked at exploring the gaps within our OHT catchment area. So looking at conducting a local needs assessment and really trying to focus what is the caregiver journey and what may be contributing to caregiver burnout. So we completed a series of caregiver focus groups earlier in the year to get a better understanding of the local caregiver experience. It was really great. It was a really great opportunity for us to actually engage with local caregivers in our community from a variety of different backgrounds, a variety of different social and economic backgrounds, and also looking at caregiving from different levels of care. So not just from hospital to a community, but also community back to hospital. In the next couple of slides, I will provide a summary of the findings. So what did we actually hear from our caregivers? What were some of their challenges that they experienced? And they also provided us with a summary of recommendations. So what do caregivers actually need to help support them with their caregiving journey? And next slide. Thank you. So this is an overview of the summary of findings from those caregiver focus groups that we held. We asked participants to share their experiences during the pre-transition, transition, and post-transition and care period. So really focusing at the continuum of the caregiving journey. Participants experienced the most challenges during the pre-transition and transition periods, which we also took into consideration when we were developing our caregiver initiatives, which I'll go into detail later on. So some of the findings that we've heard are listed on the screen here, with one being challenges in managing the care coordination, lack of appropriate resources and information, family stress, strain, emotional guilt, burden, and financial challenges, mixed experiences regarding communication with the care team, and limited home care supports. So participants felt more comfortable during the post-transition in care, as they felt better equipped with the information after having gone through a caregiving experience. So I just want to note again how important it was that we really looked at the caregiving experience across the care continuum. Next slide, please. So this slide just provides you with an overview of the recommendations that we've heard from our caregivers. So the first being providing information on financial support and guidance, access to mental health supports and counseling, develop more accessible, relevant, and timely information, provide advanced care plans as a tool for more person-centered care, comprehensive and early orientation to options to support aging in the right place, and investing in culturally appropriate supports. Next slide, please. So leveraging the findings from our caregiver focus groups and from their recommendations, we really took this into consideration as to, okay, how do we want to build out the various caregiver initiatives within our OHT, also keeping in mind OCO's Essential Care Partner Program and their 3 pillars that they have outlined so well, so identify, include, and support. We developed our caregiver initiatives leveraging this similar approach, and we've developed 3 different buckets of work. So supports for service providers, supports for caregivers, and then a system-wide approach. So really looking at supports for service providers was really about an education piece. So educating our service providers on the important role of caregivers within the care team and within those transition points. So we did hold a senior services provider fair, which I'll go into detail a little bit later on. We also held an education session as well to provide our service providers with baseline knowledge about caregivers. Looking at supports for caregivers, we wanted to build out an actual tool that caregivers could use to help them navigate the system. So we developed a caregiver resource hub. We also are providing caregiver support groups currently out of our OHT hub location as direct support to caregivers. And then lastly, looking at a system-wide approach. So implementing the Essential Care Partner Program through the OCO, starting small with the hospital at Humber River Health, and then bridging out into community later on. So I'll go into a bit more detail into some of the change ideas we actually implemented. Next slide. So looking at supports for service providers, our first change idea that we implemented earlier this year was a senior services provider fair, So really trying to build out that navigation piece for our service providers, allowing them to connect with agencies in the community that actually provide services that may be able to support seniors. So really the goals and objectives of this fair was to improve patient transitions and discharges and service navigation. So the audience for this fair in particular were discharge planners at the hospital, care coordinators at the hospital as well, and anyone working with in capacity with discharge and transitions. And again, it was really to inform our service providers about what is actually available in the community and how to make the most appropriate referrals if they've noted a need from whether it's caregivers themselves or the patient or client on services to access within the community. Next slide, please. The second initiative that we implemented as supports for service providers was an education session, which we held in partnership with the OCO. We had 45 different service providers from different organizations and across different sectors attend the webinar. And it was really with a focus on providing our service providers with practical tools on how to actually support caregivers. So looking at, for example, the OCO caregiver, I'm a caregiver toolkit, and looking at how to actually assess the needs of caregivers upon that initial transition phase period. So whether it's identifying, caregiver burnout or tools that a caregiver can use to identify their burnout. This is one of the things that we had walked through with this group. We're also looking at down the line, holding other webinars around cultural competency, because that was identified during our caregiver focus groups as a need. So working with caregivers of racialized backgrounds and different backgrounds to provide them with the necessary care that they would need. Next slide, please. So now we're looking at supports for caregivers in particular. We've developed a caregiver resource hub on the OHT website. So you can visit it by scanning the QR code or accessing it via the link on your screen here. And really, this online resource was developed in collaboration with local caregivers and our local service providers, and it really captures important information to support caregivers as they navigate through the local healthcare system. So we really leverage the findings from our caregiver focus group to help develop the actual topics that are included on the Caregiver Resource Hub. So we did include resources on advanced care planning and goals of care, tips for managing transitions in care, so giving an overview of what to expect in different care settings, information on accessing key supports, including financial aid, respite care, support groups, mental health and addiction support, and then lastly, linking to navigation tools such as Health 811, the Toronto Service Directory, and many more. Next slide, please. So under supports for caregivers, we're also providing a workshop out of our hub space here in the OHT. So this is through one of our partners, Reconnect. And this workshop focuses on supporting caregivers who are caring for people with dementia or Alzheimer's or age-related illnesses. So moving forward, we'd like to continue offering support care groups out of the hub space, whether it's in person or online, really just trying to support with offering caregivers direct support with specific patients or specific populations that they're serving. Next slide, please. So looking ahead from a system-wide approach, as I mentioned before, we are currently implementing, one of our partners, Humber River Health, is currently implementing the ECP program, the Essential Care Partner program, at 2 of their units. So they did implement the ECP program at the Reactivation Care Center, the Finch site, looking at expanding to community in the spring of 2025. So really looking at, okay, how can we take the learnings from our education session? How can we take the learnings from our caregiver resource group to actually build it into policies and practices at the system level to influence this change? So although it is being piloted right now at Humber River Health, we are working with our local service providers to see how we can implement this within the community. So whether it's the caregiver ID program, for example, or specific policies around including caregivers within the care plan development, for example. Next slide, please. And this is just an overview of some of our initial successes and opportunities. So in terms of successes, it was a great opportunity for our OHT to pilot a co-design model. So we were able to leverage PFAC to bring diverse thoughts and ideas into the actual development of our caregiver initiatives. It also helped to break down silos between service providers and and community members. Throughout this process, we reiterated that PFAC, they're not just consultants, but they are key stakeholders within this work and do provide insights and perspectives that our service providers or local agencies are not able to provide. Another success for us was the alignment between multiple OHT priorities. So being able to align our ALC CQUIP with our BPSO work, it just helps us to move this work forward and also leverage the capacity of our partners to move this work forward. Some of the opportunities for improvements, just working with PFAC and having clear roles and responsibilities to ensure that not only is PFAC aware of their role within this work, but also how they interact with service providers and what service providers can expect from PFAC as well. One of the key things we've learned is that we need to embed caregivers into our OHT strategic plan as a key priority population, and that is really an enabler of the work and allows us to build out from a system-wide level supports for caregivers. And that it plays a hand in long-term sustainability of this work. Next slide, please. So some of the next steps for our OHT is looking at monitoring and evaluating the efficacy of our caregiver resource hub. So really looking at, okay, are we missing any resources on this hub? Is there anything that we need to remove that's no longer relevant? Is there anything that we need to include because it's a need within the community, or it's a need that our service providers themselves are seeing? Some of the next education sessions I mentioned before that we're looking at hosting is around cultural competency and potentially advanced care planning as well. This was also an opportunity for us to design a co-design model for the OHT and really leveraging our findings, working with PFAC to build out what future OHT initiatives could look like when involving PFAC. And then lastly, spreading and scaling the Essential Care Partner Program to our community partners. So looking at in next fiscal year to bring the components of the ECP program to our community partners. The next slide is just my contact info. If you're interested in learning more details about the work that we've done, you can reach out directly to me, and I'd love to chat more about the work that we've done. I think that's my last slide. Yeah.
That's great. Thank you so much, Tiffany. I really appreciate your sharing about the breadth of work that you and Adam and the team at Northwestern Toronto OHT has embarked on, and it's quite extensive and really covers so much from all of those pillars. So thank you for sharing this work in action. I don't know if we're going to have enough time for questions. We have a couple of minutes left, so I think what I'd like to do is maybe I can just go to the last couple of slides that we have to kind of wrap us up. Certainly, if you have questions, pop them in the chat, and you can reach out to us here at OCO. We're happy to have further conversations with you. But leaving this with you that please reach out if you'd like to get in touch with OCO. We're happy to connect and meet with you to talk a little bit about how you can integrate caregivers in your work at your OHT. We certainly know that one of the key ways, and Tiffany spoke to it today, and you can see it here as a quote, the idea of really defining caregivers as part of the priority population or a focus for your OHT is a key way to move this work forward. We heard from Adam about the importance of being involved in these tables to offer perspective, and his rich experience and knowledge of caring for his mom. So thank you, Adam. And that when you're considering all these pathways and your improved, integrated care models, consider and think about the specific and important role that caregivers have in transitions and out into the community. So happy to connect with you on this and think about ways that caregivers can be supported in their role. It's 2:00. I'm just going to pop a chat with a survey. I want to take a moment to, we'll follow up and send along these resources, including these slides. I've put a chat there if you can offer your perspective and your feedback about this experience today. And thank you to all of you for joining us. Thank you to our presenters today. They were absolutely phenomenal. Really appreciate you, Tiffany, Adam, Kristen, and Lindsay sharing about all of your work, and Adam in particular, you sharing your very real experience. So thanks everyone, wishing you a lovely afternoon and take care.